papers that you got, all those colorful sheets that Iris gave you. She gave you those, correct?
Yeah,
Okay.
yeah, I've already read them.
All right, so let's talk about the surgery first, and then I am going to go over a couple of things with you. So your incision will be 6 inches. For a total knee replacement, it's from about here to about here, just on the inside part of your kneecap. We use retractors, open up and protect the skin. We protect the patellar and quad tendons and the kneecap. So this model here represents a knee that's got really bad arthritis in it. You can see on the side where there's this little etched line to show you how much bone we remove. So we make 5 different cuts on the femur, and then 1 flat cut on the tibia. We remove all the inside stuff, so we get rid of all the arthritis. Both medial and lateral meniscus, the ACL and the PCL come out. We leave the side ligaments alone.
And my ACL is totally torn as it is. So.
Yeah, but it's still in there, so it's coming out.
Okay. Is this a posterior stabilized version?
This model is not, but
that's what I'm getting.
Yeah, I assume that's what Dr. Yusuf talked to you about. That's why you know that term. Most people don't know that unless they're in medicine.
I knew it because I have a friend who does.
Gotcha. So yeah, this model is not a posterior stabilizing, but I don't have a model that shows that here. So, but there's 5 different cuts. The only difference between this and a posterior stabilizing is you get an extra, what we call a box, put in right here, and that makes room for when you have your poly that fits in like this. There's a little post that comes up. And
so this is the actual material that's put in place of the meniscus. Is that the
correct?
idea?
Yeah, this is your weight-bearing surface called polyethylene. So we make the cuts, we size up the right size of femur that fits your bone structure, and then your implant is cemented into place. Cement holds the metal into there, just like if you've ever had a crown put on a tooth, they shave the old tooth down, put cement on it, put a cap on top. The tibia, we make the flat cut, we punch a hole for the tibia post to fit in there like that, and then your poly will have a little post that pops up here that fits into that little box that we talked about to help stabilize it posteriorly. The surgery will probably take about 45 minutes or so. From the time the skin is cut until the implants are in, you'll be in the operating room for about an hour to an hour and 15 minutes. When we're done with the surgery, you get 3 layers of stitches that are all underneath your skin. They all dissolve. They'll take about 3 to 4 months to completely dissolve, so you'll probably feel them underneath there for a little while. You get 2 layers of bandages. Your bandages are waterproof, so you can shower, but you cannot submerge your knee in water. So you can shower, but no bathtubs or hot tubs or swimming pools for at least a month. I'll write the date on your bandage when you can remove that first layer. So it'll be 1 week after surgery. That first layer comes off, and then the second layer is glued onto the skin. It looks like a piece of mesh that's glued on with some Dermabond skin glue. You will leave that alone, and when you come back and see me, I'll remove it for you. Our plan will be for you to discharge from the hospital, or where are we having your surgery at?
Star.
The Star. So you'll discharge same day from the Star, and you will go home, and the day after you get home will be your first visit from Home Health Physical Therapy. They will send a therapist to your home 3 days a week to do an hour of therapy with you each visit. After 3 weeks, you come back to see me. I'll make sure that your incision's healing well, that everything is progressing well, that your range of motion is appropriate. And at that time, you should be ready to advance to outpatient therapy, where you will continue going for anywhere between 4 to 8 weeks. We'll just play it by ear and see how you're doing. Our anticipation is that you'll come back around 6 weeks for another office visit, and that one you'll see Dr. Yusuf. That visit, he's getting x-rays, make sure that the implants look good, and assuming everything's going great at that point, you'll kind of sign off for a full year, and then you'll come back and see us about once a year to get an updated x-ray. That's kind of the gist of everything. Oh, I forgot to mention, anesthesia is going to call you the day before surgery. They'll review with you the type of anesthesia that they will perform. Most likely, they're going to be doing a spinal block, which numbs you up from your waist down.
Yeah, that's what he mentioned.
And then they'll give you propofol through the IV, so you'll be asleep, breathing on your own, but you'll be comfortable and not aware of what's going on around you.
Good.
They also place a local nerve block in your leg, which you probably read about. This local nerve block will give you numbing medication into your sensory nerves. that will be really helpful for pain control without the use of a lot of extra narcotic medications. This little pump stays in there for 3 days. So there'll be a small little catheter or a tube about as thick as this string here, or about the size of the thickness of a paper clip. It stays in there for 3 days. After 3 days, your home therapist can pull it out for you.
Excuse me, do they put lidocaine into your knee when you have your surgery?
We use a cocktail of medications, but yeah, we use set like 5 different medications to inject all the soft tissue before we close up.
Okay, what are they? Would I know of these?
Offhand, I can't remember all of the ingredients of it. We use a little bit of ketamine, some Marcaine, which is similar to lidocaine, just lasts longer.
Okay. Well, anyway, you inject that stuff into the knee during the surgery so that it helps with pain later on.
Yeah.
Okay.
So you get the injections, you get the catheter block, you get the spinal block. So you're going to be pretty comfortable. Now, that's not to say that you're not going to have pain. I want to be very clear and straightforward with patients that have never had knee replacement. It's not an instant gratification surgery. You've got to work to get to being happy with it. Well, that entails a lot of physical therapy, a lot of stretching, a lot of exercises that at times are going to be pretty uncomfortable. That's why we give you medications to help kind of take the edge off. But understanding that eventually you're going to be happy you did the surgery. When I see patients after a year after they had their surgery, I always ask them the same question, and I'll probably ask you, when were you happy that you did this? Most patients tell me that it's about 6 months. When they're really happy, they're not on any, not taking any Tylenol, they've kind of forgotten that the surgery happened and they're living life and doing what they want to do. So let me go over some of the papers that we gave you. I want to talk about your medications for after surgery. You're going to get a phone call from Jana. You have to have her phone number here. She is, her title is, she's a nurse over at the Star, but she has a special role over there called a joint coach. So any patient of ours that has joint replacement surgery at the Star gets a phone call from her. She might even mail you some stuff. So be sure to touch base with her as we get closer to surgery. All right. You've already done all the marking up for me. So essentially the most important thing is you got to get cleared by your primary care doctor 2 weeks before. No fish oil or herbal supplements or omega-3s. If it's got a plant-based product on it, then you should stop using it. If it's got a vitamin on the label, then you can take it. Aspirin and NSAIDs, so Aleve, Advil, ibuprofen, or any prescription anti-inflammatories have to be discontinued for 1 week before surgery. This ointment called mupirocin, I will prescribe this to you. You'll use this for 5 days before surgery. This kills off any bacteria that might be in your nostrils that can get onto your skin. So we just eradicate the bacteria before surgery. To help with eradicating bacteria, you're going to use Hibiclen soap. Jana may mail you some of this, or you can go buy some of this at like CVS or Walgreens, pick it up. You'll use this for 3 days before surgery every time that you shower, and then also the day of surgery. Wendy will contact you the day before your surgery and let you know what time you need to arrive. Unfortunately, we just don't know 2 weeks ahead of time what time your surgery is because we don't have our final lineup finalized at that point.
Okay. So I was told 5:30 to be there at 5:30.
Who told you that?
I'm not certain.
Wendy or Dr. Youssef?
This wasn't today. This has been. This was when I scheduled.
Okay. Yeah. That's probably going to change. I don't know if for sure it's going to be 5:30. All I'm going to say is our schedule. Were you like supposed to have surgery and then they rescheduled it?
No.
I'm surprised that they told you a time because we don't tell our patients a time until like the day before because we just don't know what our lineup looks like.
Okay.
That far in advance. So I would not show up at 5:30 unless you get told again by Wendy to show up at 5:30.
Okay.
The night before surgery, nothing to eat after midnight. On the day of surgery, you can drink water or Gatorade up to 1 hour before your arrival. We encourage you to drink so you're hydrated and it makes getting the IV started a little bit easier. Are you diabetic?
No.
And COVID testing is not required at the STAR, so you don't need to worry about that last part there. Medications that you're going to get after surgery. For pain, we will prescribe tramadol and oxycodone. We're going to hold off on the hydrocodone. I think it's not strong enough for knee replacements. The oxy is going to be the better one for you. Those are only to be used as needed. If you don't feel like you need them, then don't take it. You'll probably need to use it before your physical therapy and probably to help you fall asleep for the first week or 2 or 3. But the most important pain medication, in my opinion, is taking over-the-counter acetaminophen. Every 6 hours, keep a steady dose of that medicine in your system, and then add the tramadol and add the oxycodone if you need to, based on your pain levels. We will give you an anti-inflammatory called diclofenac. This is an NSAID, same family of medicine as ibuprofen, Aleve, or Advil. And this will be twice a day for 3 weeks. Zofran will be given. This is an anti-nausea medicine. Only use it if you become nauseous. Do not use it to prevent nausea.
So the nausea is from what?
Usually from the anesthesia side effects or from the pain medications.
Okay, yeah.
Omeprazole is a acid reducing medication. We are going to be giving you diclofenac and then your blood thinner that I haven't talked about yet. We're going to give you aspirin. Both of those medications can cause some stomach irritation, acid reflux, ulcers, so we protect your stomach from any of those complications by giving you this medicine.
Okay.
You'll take this daily for 4 weeks. Stool softeners or laxatives of your choice, those are yours to purchase on your own. So you're responsible for 2 medications, stool softeners and Tylenol.
Gotcha.
All right. The blood thinner is going to be aspirin. That is available to buy over the counter if you want. I always send a prescription in to cover myself legally. I don't ever want to have a patient say, well, you didn't tell me I had to take an aspirin and now I have a blood clot. So I prescribe it. You can decline it if you want and buy it over the counter. You'll take it twice a day for 4 weeks. Oh, I'm sorry, you take the aspirin 325. I'm sorry. I'm not going to prescribe it. But what you are going to take is aspirin. You're going to resume it. Aspirin 325 milligram. Resume. Okay. Those are all your post-op meds. Everything else that you need to know is already in this packet. It looks like you've already made quite a good amount of notes and highlights there. The one thing I need to go over with you before we wrap up is this after surgery product sheet. We work with a vendor to provide some products for our patients. What insurance do you have?
Medicare and UT system.
Okay. Medicare is your primary insurance? Yeah. And what's UT system? Is that like a state plan?
Yeah,
okay.
But it amounts to a supplement now.
I see. Okay. So what we do is we send your insurance information to this company. This is his contact information down here. His name is Danny Gibson. So we'll send him your insurance information. He will contact you a few days before surgery and let you know if these products are covered through your insurance or not. This and this should be covered. This one is the question mark. We don't know. So let me explain these two. This is a knee brace. We really don't care if you use the knee brace. The knee brace is a means to an end because insurance will not pay for this little cooling device. The cooling device, you just put ice and water in here and it pumps cold water through this hose onto the pad. We get this included for free when we order a brace. So you don't have to use the brace, but if you feel good with wearing it, you can. This is called a plasma flow unit, or I call it an SCD. What it is it's a little mechanical compression device that you put around your calf. If you've ever been in a hospital or had surgery before, you probably had one of these things on you while you stayed at the hospital. The idea behind it is that when you're up and around, walking around during the daytime, your blood's flowing pretty good. You don't have a very high risk of a blood clot. But when you rest and you're not moving, that is when you're at a higher risk. Even though you're taking an aspirin a day, you can still develop a blood clot. So what these do is they kind of massage your calf muscles while you sleep to prevent blood clots from forming. And we will send this to the company. They'll check and see if it's covered through your insurance. If it's not covered, you don't have to buy it, but we do recommend it. It's $150, and the company will contact you about how to pay for that if you need to pay for it. They will deliver this either to your home before surgery or to the STAR on the day of surgery. Any questions about that?
No, but I do have a couple of questions
Mm-hmm.
somewhere on these items. On this here. Okay, that's the polarized unit. That's
Yep.
one question you just answered. What is pump your ankles up and down?
Just a couple of little exercises, just kind of
Okay,
pointing your toes down and pulling them up, just like that.
all right, I can do
That's
that.
just to, again, keep the blood flowing and stretch out the muscles.
Okay, I just didn't know what it meant.
Yep. Is that it? Is that the only question you had?
Yeah, so the only two.
All right. So this one is the paper that talks about the nerve block. This is the paper that talks about your goals for range of motion. A little diagram to kind of show you what the degrees mean. A little chart for you to document your progress. It's a lot of information. Go home, review it, watch the video, and if you have any questions at all, reach out to us either by the portal or call us, and we will get you some answers.
Where's the link to the video or the?
To the portal. Do you have the portal on your phone already?
I think it's on my.
Health?
Yeah.
So you can contact us. Just send us a message directly through that if you have questions.
But to access the video, it's on the portal.
Your video on your phone that you're recording me on. That's what I mean. The video. There's no other video.
Oh, okay. Well, there is some reference in these papers to something, to some video, a class on knee replacement, or you can watch a video.
So depending on the location where you're having surgery done, you'll either go to an in-person class. Because of COVID, they don't do the in-person classes anymore, so they either do it through a Skype thing, or in your case, you're going to get a phone call from Jan.
And okay, so Jan
that's
is the one who will deal with it.
That's correct.
Okay.
Yep.
Okay.
Okay, that's everything I need. I got your pharmacy and I got your meds checked off. We're all done.
Okay.
All right. Thank you.
All right.
I
Thank
appreciate your
you.
time today.